Hi, everybody. Welcome to Precepting and Critical Care. I'm Kristen Rachinsky,
I'm Jeanette Rack.
And I'm Allie Martin.
and we are going to be talking about communication styles today. We hope you enjoyed our last lecture. Jeanette, what do we think about the roles of the preceptors here?
So as you can see, or are about to see, we have 8 significant roles that have been called out as for preceptors. We are going to be discussing each of these within our slides. We're not going to go in depth on all of them right now. We plan to have a 4-hour in-person component where we will discuss the competent clinician and educator roles. We'd like to do some pathophys and just touch on some things that you probably haven't heard about for a while, and that will help you become a more proficient preceptor. We also have a separate lecture planned for you regarding feedback. We often hear that it's difficult to give clear and consistent feedback, and so that will be discussed regarding evaluator role for the preceptor. Today, in our 20 to 30 minute lecture, we're going to be talking about the communicator and socializer roles. So just kind of get your head wrapped around that. Those are some areas that we're going to be talking about. I think that's all for the roles. I think I talked about this much clearer before.
No, you did great.
No,
there's a lot to know for preceptor roles. There's so much here. So what we want to do in these class lectures is to unpack a few of the key components here in our virtual webinar, and then of course for the in-person classes, and then just conversation, as this refines itself, that we just answer more of your questions and dive deeper into the things that need to be clarified. All right, let's talk about learning styles. So, like Jeanette said, the communicator role and the socializer role and that role model, those are some key things we want to highlight today. And so, as someone that's new on your unit, they are looking to be socialized into this new work family. They need a new crew, and you are it. You're leading that crew because you're their preceptor. And so as a preceptor, a key piece of that socializer is to introduce them to people and manage up when you're in front of the patient. So, hey, I want you to meet Jane. She's a new intern here in our unit, and she's going to be the point person for all of your questions, clinical questions for our patient assignment today. So please call her on both Sarah and, just introduce them to people and make them feel welcomed and as a part of our team as they are. And then the role model, of course, demonstrate good practice, show the way, model the way in everything you do and say and respond. And then communication is kind of where we jump into this next bit about learning styles, because there's so much. Can we just say that, 85% of the nursing profession are visual and kinesthetic learners. That's super valuable if you're a preceptor, or if you're just wanting to understand yourself, because there's really some pretty good evidence-based reasons why we tend to gravitate towards, hey, can you show me how to do that? We're visual learners. We want to get hands-on. But when it comes to precepting, knowing who you are is very important, and it's at the heart of how you connect to other people, how you communicate with others, and guide them through this internship process. So we've got some personality style tests we called out, and there are so many. Oh my gosh. Allie, talk about this. Personality styles.
So we kind of all did a few of these. Enneagram was the one kind of Kristen brought to us. I personally like the core values index, and Jeanette brought in the flow living. And then there's also other ones, the DOPE, Myers-Briggs, Colby, Strength Finders. There's a ton of these out there. And ultimately at the core, what it is just trying to figure out who you are, how you learn, and how that can translate to other people. So if you know what your strengths and weaknesses are, then in turn you can use those to facilitate others and be cognizant of yourself and how that translates to your teaching styles and your feedback styles or your learning styles. So that's kind of what we did in bringing all of these together.
Yeah, absolutely. So we want to think about, okay, so here we are, we're wanting to know ourselves, we're wanting to know others and find out how to communicate things. And these were called out as some really good pieces for encouraging critical thinking. And Jeanette, you highlighted these. You want to talk about some of these?
Was it me that
Actually, it was
highlighted
Allie.
that?
I'm
I think it
sorry.
was
You're
Allie.
like, I don't
Yeah.
recognize these. No,
Okay,
I'm sorry.
I'm so sorry. It was me. So I feel like a lot of times when we're communicating with others, it's automatic maybe sometimes to say, do you have any questions for me? Or, you know, do you need anything else? Because that's kind of how, you know, we might talk to people who are of experience, or you just don't realize in the way that you're asking these questions, kind of, you want to provoke question asking, and you want to always have that, you know, open dialogue of someone willing to ask a question, also opening it up where you maybe ask the question to your orientee or your preceptee before they ask it, because they might be nervous too. So things like, what are the outcomes? How much room for error? What is our time frame here? How much time do we have? What else, you know, what other resources might help us? What's influencing your thinking? What might come up? What are the outcomes? What are you looking for? So just kind of more open-ended questions, so that it just promotes the that open dialogue between you and your preceptor, rather than, do you have any questions? Oh, no, I don't. Because it's almost like, oh, you don't really want me to ask a question. You always want them to ask a question, because that's where all this learning comes from. And also it will help in all other ways, such as preventing errors and building trust between the two of you.
Yeah, totally. And, you
I
know,
really,
teaching, go ahead.
I was going to say, I do really love these questions, especially. I noticed there is a preceptor style that is asking almost quizzical questions, or like test questions, that some people, they're not great at test taking, and they may shut down and not answer the question correctly, or feel like you're kind of giving them a pass fail question. These questions are really great because you are trying to invoke critical thinking, but you want to do it, especially in the beginning stages of a preceptorship, questions that make your intern feel confident and want to engage in those in dialogue and open room for, give them confidence to ask more questions.
Yeah, totally. We were talking a little bit before this session about how do you teach someone to think critically? There's so many elements of data and safety and assessment that go into each of our nursing actions and evaluations every moment. And so teaching someone to think critically about a topic, a type of patient population, a lab value, a pathophysiology process, whatever it is really complex. And I want to highlight what you just said, Jeanette, because if you ask questions in a way that sound like a test, that is the fastest way to shut somebody down and put them in sympathetic activation and make them afraid. And they're just going to clam up. Or worse, they're going to showboat. And they're going to try and just stab at something to be right, because that's what they value in their personality. And I've sat through classes like that where they start asking these test style questions, and it's awkward. Like the whole room just shifts to this really negative space of being like, oh, I don't know the answer to that. It's terrible. So open-ended questions, right, Allie?
Right. I would say it's not about being right. It's about getting it right. And that's what Brene Brown says in her book, Dare to Lead. You want to get to the right answer, whether it's, and even if you don't know it as a preceptor, that's okay. Where do we find it? Let's look it up together. Let's look it up separately and collaborate together. I think that's another key piece of it. You don't have to know everything. You just have to know where to get to that.
Absolutely. That's a good call. It's not about being right. It's about getting it right.
Right.
That's true. Okay. Critical thinking, always in progress, open-ended questions. Don't shut them down. Keep fostering the learning environment, that teachable attitude. So key. All right. Well, one of the things that Allie called out was we took a few of these personality styles that are all aimed at understanding self, right? Because if I understand myself, then I know what tools and resources I have intrinsically to give to somebody else, and that I can't give what I don't have. So if I have awareness about what it is that I'm good at, what it is that I'm not good at, what's my talk style, how do I act when I'm in stress, all these things, then I am much more equipped to be a good preceptor. And so that's why we wanted to highlight some of these. So we have all these resources available for you. I have them, so please ask me if you would like to know more about these. You can find them very simply by a quick Google search. But Allie did the core value index, and so I want to let her talk about that.
Right. So the core values index is basically, it shows you what your core motivations are, what maybe your unique learning styles, conflict strategies, and your communication strategies. So it kind of breaks it down. You typically have one primary style, and then you have a secondary style. So I am a innovator banker. Perfect. So this is kind of a quick snapshot here of the different core values, and then how you contribute to the team, what are your conflict strategies and your learning styles. So there's a whole book on this, and it can get super deep, but after you take the quiz, it's super short, and it will kind of break it down for you and give you just like a quick snapshot of kind of what you are and how you learn. It seems to be that a lot of nurses are merchants. Through compassion, I just happen to be a compassionate nurse that is an innovator banker. But it's super helpful to me in what you can contribute to the team, what are your conflict strategies, and kind of what motivates you. But then knowing someone else's can also help you teach them as well.
Yeah, and can I say this was a super fast test to take. It literally took me 3 minutes to get the results of this. So having something that's really helpful and provides insight, but also is really easy to get, that was a win for me.
For sure.
And
Allie,
I was the merchant banker.
Allie, did you say you were innovator banker?
Correct.
Yeah, it says compassion under innovator.
Oh, it does.
But I think because merchant core value is love, we often probably link love with compassion, but they're two very different things. Compassion seems more like empathy, and you don't have to love somebody to have empathy for them.
That's true.
Oh yeah.
It does
So
say, yeah. So
compassion.
you have wisdom supported by compassion.
Perfect. I'll take it. I love it.
Yeah.
Jeanette, what were you?
I was a merchant innovator. And I had like no builder. That is something I need to work on. I kind of crumble under
not power. That's so interesting. Okay, so after you take the very quick test and it just shows you some pages of words that you associate with, it provides you this type of a screen. So that was mine. And I just like that it gives you that graphic, because of the 4 quadrants here, it's going to show you how far you extend into each of those quadrants based on the words that you associated with the strongest. So that's pretty cool, right? Are you, someone that really utilizes words of power, knowledge, wisdom, or love? That's helpful to know as a preceptor, right? And then there is much more delineation on the explanation after you find out what you are. So, all right, that's core values index. Easy to find.
I also think it's really cool to share. I find that we enjoyed it between the 3 of us, and I've had other preceptors and preceptees do this on my unit, and it's always fun to kind of share, oh, what am I, what are you? So it's also something to me that's maybe in that social role. If you have other people on the unit that have taken it, you can kind of share together, bring your intern or orientee in, and that's maybe another way to kind of get both of communication styles and a socializer all into one package.
Yeah, absolutely. And then the cool thing to go the next level after you share it is to know where you're not that great, know where your weaknesses are. It's nice to talk about strengths, but really it's helpful to know where are your blind spots. We all have them. So where are we not so good? And like you said, Allie, share it with your friends, because if I have a friend who's a good builder innovator and I'm not very good at either of those, I'm going to want to reach out to them and resource them if I need them.
Exactly.
Alrighty. Hey, Jeanette,
Hey.
what's going on with the rhythm of life?
So this is not necessarily about personality styles, but it's more has to do with how our personality changes, maybe throughout like the rhythm of life or the rhythm of the day. I recently listened to this podcast. Griffin, if you're listening, close your ears. It's called Unlocking Your Hormonal Advantage. And, you know, I'm sure we've got some men listening, but we are a woman-dominated field. And it kind of talked about the difference between what's called the circadian rhythm, which we're all familiar with, the 24-hour day-night cycle, and the infradian rhythm, which is any other cycle other than the circadian rhythm. And in this instance, it's referring to a 28-day cycle that most women go through. Will you go back to the other slide for me?
Yeah.
The circadian. So the reason why I just found this interesting to point out is that there are certain times of the day and there are certain times of the month that may be more beneficial for different types of learning. If you are trying to precept somebody and you may want to consider that you don't want to lecture them at 2:00 in the afternoon after a nice big lunch. You may want to be careful with having to go into deep pathophys at 4 a.m. if they're on night shift. But this circadian rhythm is more in tune to men in terms of hormones. Your men's hormones are depleted throughout the day. When they go to night, they're restored. When they wake up in the morning, their testosterone is back to their baseline level. As the day progresses, their testosterone levels decrease. They go to bed, it resets the next day. And most business meetings, office workflow, our days, whether we realize it or not, are set up to kind of reflect the circadian rhythm. There are times of the day, like I said, where you're better at listening, focusing, learning, lecturing, sleeping. Now, if you want to go to the next slide, if in this same realm, if you want to extend this out to a 28-day phase for a woman, I'm apologize to any men that are listening, but this might also help you understand the women in your lives a little bit better. We always often talk about the time of the month. We just think like, oh, I get maybe a little bit more hormonal or emotional or tired around the time of my period. Because that is a very obvious sign to us, something is physically happening to us so that we can kind of link that time of the month. But there are also other times of the month that our hormones are constantly shifting, like a man's testosterone in a 24-hour period. A woman's estrogen and testosterone are shifting throughout a 28-day period. So here you can see this little cheat sheet. You probably remember this from nursing school, the follicular phase, the ovulatory phase, the luteal phase. But during those times of the month, like during your menstrual phase, you're low energy, you're tired, you like warm, nourishing foods. Maybe you find that you're more flexible. I think most of us are pretty in tune with how we get during that time of the month. The things that we often overlook and don't really recognize are the other phases of the month. So your follicular phase, you might be a little bit more sharp. You might have more energy. Your ovulatory phase, you might feel more confident and outgoing. You may just notice these different things. So the way that this plays into precepting is if you're precepting somebody and you think, oh, wow, they're so tired, or they're not really interested in talking, or they don't seem like they're listening to me. I thought they were more engaged last week. There are plenty of things and factors that play into our life and our daily life outside of work. And this is a great example of something of why we might change from week to week. And just not saying that you have to like walk in at the beginning of your shift and announce what phase you're in or to your preceptor by any means, but I found this really interesting. It kind of was really eye-opening for me. And because we do work in a woman-dominated field, I thought it was a really interesting thing to highlight. And I made Kristen and Allie both listen to the podcast that I listened to. And I think Kristen just confessed to me she bought a ton of stuff. Sorry, she's looking at me like, wait, don't throw me under the bus.
They were vitamins. I think that's a really
yeah.
nice way to spice up group report, is to walk in like you're coming into a code, instead of saying I'm the code leader, be like, I'm in the luteal phase.
Yeah, I'm in the follicular phase. I'll do compressions. I need an intense workout.
Perfect. All code. Oh, we're leading codes by cyclosyncing now. I love it. Type to-do list. I'll be the recorder. Luteal phase.
There you go.
Yeah.
That's right. Oh my gosh. No, this is so fascinating though. I love that you called this out, Jeanette, because, you know, this big macro picture of, hey, different humans run on different timetables, and there's benefits and sometimes maybe a disadvantage to whatever part of the cycle they're on. So I think, as you said, as the preceptor, you know, if your preceptee comes in, or you're feeling, you know, one of these things and you're kind of feeling at a disadvantage because one of these, to not jump to a conclusion, you know, some sort of conclusive statement about somebody. Oh, they just don't seem to be engaged today. They don't care. They're not participating or whatever. Like, just, you know, maybe zoom out. The whole goal of talking about personality types and tests today is to try and broaden all of our perspectives about, you know, who we are and what we offer and how to see and value other people, like we've already said. So I hope this provides a fresh perspective to report and code leading and precepting. Oh God, I love it. All right. The Enneagram is a personality test that I've enjoyed over the last few years as somebody that likes to work with people. The Enneagram is like these other tests. They're about seeing the strengths and talk styles of other types of people and trying to, I feel like the goal of it is to honor that person for the unique set of talents and skills that they bring, and to not try and change them. I found a lot of benefit in the Enneagram because it forced me to, I was always used to finding common ground with someone in order to understand them. So I had to find something like, oh, I understand that about them, or I have empathy for this thing, or there was some sort of, I felt like I needed a connection of some kind in order to understand. And the Enneagram made me zoom out and realize, like, yeah, I don't need to have anything in common with this person. That's totally okay. They are, so like the 4 is in this graph, it's called the designer. In this graph, they're the investigator. No, that's a 5. Sorry. Anyway, the 5 is almost the opposite of the type that I am. And so when I know people that are in these different groups than I am, it's really hard to have things in common with them. And so sometimes it can be hard to understand them, or like, hey, I want to understand where they're coming from type of motivation, pure motivations, but they can go awry. And so the Enneagram helped me to realize that I don't have to have anything in common with them, and they can be a totally different talk style. So it goes into, you know, how does, like, the challenger is a number 8, and, you know, how does that type of person present in a professional environment, a personal environment? What's their talk style? How do they act when they're stressed? So all of these elements are called out for each of the types, and then also what motivates them. So in doing some of the work I did on Enneagram, I found out that the number 6, which is called the troubleshooter in this diagram, it's also called the loyalist in some of the models for Enneagram. And it talks about how the loyalist, what motivates them is fear. And so the majority of the world's population is an Enneagram 6, or believed to be an Enneagram 6. And so that's why fear-based marketing is so effective. Anyway, so I thought that was fascinating. But I'm a 3 with a 2 wing. So you can have a dominant type and a subdominant type. And that just helped me understand, oh, that's really what makes me tick. I'm encoded to be that. I wake up and that lens is how I see the world. And so just knowing, hey, you know, my spouse, he's not that, you know, he's a 1. So when he wakes up, that's the way he sees the world. And so that's the way that he's motivated to get stuff done throughout his day. That's his talk style. That it helped me so much in understanding the people that I love and care about, and also as a preceptor, people that I meet and I want to precept. This is just a really visual way to describe the different parts of Enneagram. So they're each given a number. There's 9 of them. Ennea is Latin for 9. Gram is picture. So there you have it. It's the 9 different majority personality styles. And you can have one that you are pulled to the strongest. So that's your dominant style. And then you can also have like a little, they call them wings. So I'm a 3, which is the achiever. It's what I'm most motivated to be. And then my subtype is a 2. I'm a nurturer. So that's my little wing. I'm a 3 with a 2 wing. Allie, I know you've taken this.
Oh, I was going to say I actually had a tie with a 3 and a 6 with a wing of 8. So I guess that's, yeah.
You got lots of strengths. Jeanette, did you have a chance to take this?
I took a free online version that was like a shortened version, and I got a 5, and I just don't really trust it, to be honest. It doesn't really.
That's right on for you.
It feels okay. I feel like I'm a 9/7, but I'm going to retake it. Allie said she took one that she paid for, and I might just fork over $12 and
I read a book.
It's
called The Road Back to You by Ian Morgan Cron. And he highlights different famous people that are the different types. And that was really helpful because, you're like, oh, that person. Oh yeah, I guess that's, sort of like that. He did call out that the majority of US presidents are Enneagram number 9s, excluding our current president. He's an 8.
That $12 quiz I took, also, if anyone else is interested, it actually highlights, I just looked at it again. It highlights what page in, actually some other books, Discovering Your Personality, Personality Types, Understanding Enneagram, and then what page number it's on. And then it also gives examples of famous people. So nice. That's pretty cool.
Well, we would be amiss to not call out that amongst all the different personality styles there are. And so, going back to that list we showed earlier, Kolbe, StrengthsFinders, Myers-Briggs, there's so many different personality styles. No matter what test you find valuable, the more you make an effort to understand yourself as a component of understanding others, I think that will always pay dividends. Would you guys agree?
Yes.
Most definitely.
All right. And we also want to just acknowledge that, hey, there's different age groups in the nursing workforce and in providing hospital care. So I think this is a reminder to all of us, but, depending on when you were born and when you joined the workforce, you have different learning styles that you were brought into. And so just acknowledging, if you're working with folks that are of different age groups and different learning styles, there's a component overlay of adult learning style that comes with our age groups. And it's not exclusive, because there's certainly people that break the mold in each of these that I can think of. But, there's some patterns to be respectful of. So as preceptors, we want to be respectful and aware of all the different needs of our preceptees, and just, asking those curious questions, finding out more about them, valuing their learning experience and their past, and helping them be assimilated into our team, helping them be successful. And then, of course, old sweet Benner, Patricia Benner, Novice to Expert Continuum. This is a theme throughout our series of class sessions that we're going to hold, but you guys, this will be a reminder to you, and we want to just highlight it and talk about how to navigate it, and maybe have a little more grace for somebody who's on the novice side, and to have compassion to remember what it's like to be new. It's really hard to be someone that's new, especially for people that are transitioning from a previous work unit where they were the expert. They were so proficient. They were the person that everybody went to. They were a charge nurse. They were, whatever that is on that unit. And now they're here in critical care, and they're all the way back at the beginning. And just to remember that that's a hard transition.
One thing to add on that, I will say something that just recently did I kind of realize what was holding me back from like advancing my career in some ways, of making a commitment to like try to potentially go to ICU or all that. And I think I realized deep down, this is what it was. It was feeling and being proficient and an expert now in what I do and where I am, and that's comfortable. And then it's not that I don't think I could do it, or that I, necessarily doubt myself and my ability, but then I realized it's because you're going to be a novice again. And that, to me, I realized like, oh, that's scary to me, because that's not what I'm used to at all. I enjoy being that helper and that resource, and having to totally switch your brain and like not feel totally lost and not know anything again in a way, is can be pretty scary. And that's an uncharted water that you haven't been in a while. So I think this to me is very helpful, just trying to remember what it's like to go from being comfortable where you were to completely going back to novice. Not that I'm novice in my career, but novice in the arena that I would be in. Same with our interns. So
Yeah, totally.
I think when I came to the ICU from 3 South, I felt this gravely. That I think the part that is harder than moving from novice to expert is truly the part where you're an expert moving to novice. Especially, I mean, we said it's one thing if you're a nurse and you decide to become a florist. I think that feeling to some people is exciting and, really re-engages your learning. But when you're a nurse and you go then to become a different type of nurse, or more advanced in the type of nursing that you do, like if you're coming from PCU to ICU, you're afraid that people have the expectation that you know all of the things, or at least you had experience with ventilators maybe. And so if it starts to show areas that you feel like you should have been proficient in, sometimes people have a hard time admitting that. When this happened to me, I found one of the tactics that my preceptor did to help me kind of break out of the novice fear was he would do his best to highlight what I was an expert in. And whenever he had the opportunity to say, hey, you're from 3 South, you're an expert in peritoneal dialysis. Listen, we're trying to like revamp our program. Maybe you can take a look at our policy, or maybe you can take a look at our IC resource books and see if we're missing anything. Or anytime there was a peritoneal dialysis patient on the floor, he would make an effort to pull me over, even if the nurse kind of knew what they were doing, to show like my other colleagues, like, listen, she is an expert, and maybe she's still new here, and maybe she is shyer or not being her normal self, but you can like see her personality shine when you highlight what they're an expert in. That was super helpful for me.
I think that also goes back to that socializer role too. That's bringing both pieces in, I think, and you're boosting confidence. You're breaking that barrier of like, I don't know anything because I'm brand new here, and you're also socializing them to the crew. I think it's definitely super important in what we do as a preceptor. So.
Yeah, and Jeanette, to kind of dovetail off what you just said, that there's value in each step. So as nurses, we always want to grow and learn and achieve. I'm the achiever, right? But there's value in being a novice. You're going to see things, just like a small child, the way they experience the world, and you get to watch them. Wow, they saw this for the first time, or they heard this for the first time. There's something really precious about each of these stages, and a person that's in one of these stages has value all on their own, as an advanced beginner, as a competent nurse, as a proficient, as an expert, as a novice. And it is very scary to go back from that expert role to the novice. And that does hold a lot of people back. And when they make the jump, we want to be right there as preceptors to say, hey, I remember what it's like to be new. I know it's scary. That's okay. Let's start with what you feel really good about. What do you feel strong about? All right, let's start with that. Let's build from there. That example you gave was really good. But there's value in each of these. So as preceptors, I want to challenge you to See the value in that person in front of you, no matter what part of the continuum they are in. They have value to bring, and often it's that novice role that says, hey, why do we do it like that? Why do we do it in this order versus that order? And as the expert, I've been challenged so many times where I say, you know, that's a good question. I don't know why. I'm going to go back and look that up. And then it helps teach me because they have a different perspective.
Right, they bring it back down to the basics in some way where we're so used to functioning on, or wherever, you know, the preceptor so used to functioning on this almost like a, just on autopilot, and you do things because we don't realize how much we're critically thinking and tasks that we're doing all at one time. It brings you back down to building it all out, and starting from the base. And I think it's definitely helpful for and allows preceptor growth as well, for sure, I think.
Yeah, I agree. And it's never going away. It's always a continuum. We go back and forth, and there's some discomfort in there for sure. All right. Well, any parting thoughts, ladies?
Have a good day. Thanks for listening.
Thanks for being a preceptor. We appreciate you watching this virtual class, and we know we will be seeing you in person very soon. So thank you. Bye.